Hello, my name is Pirani Zuberia. Today's topic lymphedema. Lymphedema it is a chronic disease. It can be marked by the increased collection of fluid in the body. It can be caused by the swelling in any part of the skin and tissue damage. The chronic disease it can be progressively accumulation of the proteins and fluid within the interstitial and fibrous adipose tissue. Lymphedema it can be occurs any part of the body like legs, genital area, neck, chest wall and oral cavity. Lymphedema classified into two types, primary and secondary. Primary also known as genetic and secondary also known as acquired. Etiology of lymphedema it can be primary or secondary. Primary classified three types, congenital lymphedema, second one is a paracox lymphedema and third one is lymphedema tarda. First of all, congenital lymphedema. Congenital lymphedema it occur present at the birth and recognized within the 2 years of age. It least common approximately 2%. They're more common in male in men in infant compared to female. We can see some affected area like lower extremities. Second one is paracox lymphedema. Paracox lymphedema it occurs occurring puberty or by the beginning of third decade like 20 years of age. It can be more common in female compared to male. It affected area like unilaterally foot and calf. Third one is tarda. Lymphedema tarda occur after the 35 years of age. It can be occurs older adult which have they have a weak immune system. Secondary lymphedema it result from injury of or any obstruction of the lymphatic system. Most common cause of the lymphedema it associated with the worldwide of the filariasis infection name of infection like a nematode. In developed countries of secondary lymphedema occurs due to a malignancy or related to treatment of malignancy. Breast cancer to it is a most common cause of the secondary lymphedema in the developed countries. Clinical presentation of lymphedema it can be both physical and psychological effect of the chronic condition. The physical changes like they have swelling in an arm or legs. It can be of whole limbs or only part. It can be unilaterally affected area, can be fibrosis and pitting edema. It can be feels like limbs can be feel like a heavy and achy part of the joint and discomfort. Skin changes, example like redness of skin and increased temperature of the skin. It can be hyperkeratosis and loss of hair and loss of sleep. Second one is psychological effect. People commonly detach themselves from the social console with the family and friends, leading to social isolation. Symptoms like it can be disturbed sleeping patterns. Some people feel they have loss of support and lack of support. Mm. Stages of lymphedema. Stage 0, latency stage. The patient is considered at risk for the lymphedema development due to injury to the lymphatic vessels, but does not present with the outward sign of edema. Stage 1, spontaneous, reversible, has a pitting edema. Swelling at this stage is soft and may be respond to elevation. Stage 2, spontaneously irreversible, has a tissue fibrosis. Swelling does not respond to elevation. Skin and tissue thickening occur as a limb involve increasing. Stage 3, lymphostatic lymphangiectasia, like pitting edema, fibrosis, and skin changes. During this stage, papillomas may be form of the infections and skin become dry.
As we just talked about the lymphedema, its etiology and the clinical features, let's talk about the pathophysiology of the lymphedema. Lymph is basically the fluid which is the circulating in the lymphatic vessels, and the edema mainly refers to the fluid buildup in the interstitial species. Lymphedema mainly typically is due to the obstruction or blockage of the lymphatic vessels. As oxygenated blood from the heart with the help of arteries go to the capillaries, bed capillaries, and from there it goes to the cells and tissues and give them nutrients. And from there deoxygenated blood goes from the cells to the veins and from there back to the heart. As this happens from some of the plasma and the fluid and other proteins and cellular debris goes to the lymphatic vessels with the help of the afferent lymphatic arterioles or capillaries. As they have larger openings, the interstitial fluid, the larger proteins and cellular debris, and the maybe any type of bacteria that can go from the arteries to the lymphatic system, and from lymphatic system, as this enter to the lymphatic system, this is called as lymph, and this lymph travels from the lymphatic system to the nodes, lymph nodes, and from lymph nodes it goes back to the heart with the help of the like superior like subclavian artery and the internal jugular vein with the help of this. And if any type of obstruction occur in this or blockage occur in this, there is fluid buildup and the retention of the fluid in the interstitial spaces, which can lead to the inflammation. And if any type of inflammation occur there, and there is accumulation of the proteins and the cellular debris, waste materials, there is inflammation occur. And inflammation occur, there is macrophages come when they release some inflammatory molecules, which leads to the damage to the surrounding cells, and there occur fibrosis of the surrounding cells and the tissues. And then there is thickening in the connective tissue, and then hardening of the connective tissue of the cells and the surrounding the cells. As we earlier talked about the pathogenesis of the lymphedema, let's talk about the diagnosis. Diagnosis is difficult as in early stages there is no symptoms, but later on symptoms starts to appear as there is swallowing and accumulation of more and more fluid in the limbs or maybe lower or upper limbs. But it may mimics these chronic venous insufficiency in which both the legs or maybe hands are affected. This is bilateral, but the lymphedema is unilateral in which only one leg is affected. And we can most commonly it is differentiated by the staging system, as in stage, which is latent stage in which there is normal or up to some extent the vessels are affected, but there is lymph flow is proper or continuous, so there is no lymph accumulation in the interstitial spaces, so there is no lymphedema. And in second stage, which is spontaneous reversible stage, in which we can see pitting edema. And in third stage, in which is a spontaneous irreversible stage, in which we can see the non-pitting edema if we press the limb, which bounces back. And from this stage there is also fibrosis occur. And the last stage is which is third stage, in which there is a lymphostatic elephantiasis, in which there is swelling become irreversible. There is more and more accumulation of the lymph and more fibrosis occur. And about MRI and CT scan and ultrasound we can also use. And ultrasound help to discriminate or differentiate from the other etiology like deep vein thrombosis and venous insufficiency. So we can differentiate from the bilaterally and unilaterally diseases. As we talk about the diagnosis, let's go into to the treatment side. Treatment is mainly depends on the type of edema and the fibrosis. We can use compressive bands, which helps in the reduction of the fluid accumulation, and we can also use lymphatic massage, which help in the improving of the lymphatic flow, which is normally not in the lymphedema. And we can also use, if this is not working, the massage and the band is not working, we can also use surgery, which helps in improving drainage and the reduce fluid load to the lymphatic system.
Hi, I'm Khushbu. Let's discuss about lymphangiectasia. Lymphangiectasia is also called as lymphangiectasis. It refers to swollen lymphatic vessels. This can be of two types. It can be either congenital or acquired. Congenital lymphatic malformations is sometimes called as lymphangioma. Acquired lymphangiectasia arises after the lymphatic glands have been blocked or injured. So first, let's discuss about congenital lymphangiectasia. As the name suggests, it is acquired from the mother to the baby or it is hereditary. It is present from birth in the infants. It is caused by abnormal formation of lymphatic vessels during fetal growth and development. Now, the signs and symptoms of congenital lymphangiectasia. It depends upon whether it is diffused or localized and location of the condition or the organ that is involved. So, some of the symptoms include the presence of skin lesions that may be fluid filled or bright red in appearance. When subjected to minor trauma, the tiny skin papules tend to bleed or ooze a clear or milky fluid. The skin condition can be painful. Thickening of skin due to lymph accumulation may also take place. Chronic diarrhea that can result in weight loss, associated bone lesions, pleural effusions, ascites sometimes can also be seen. Now coming to acquired lymphangiectasias. It arises after the lymphatic glands have been blocked or injured. It may be associated with traumatic injury interrupting lymphatic drainage, lymph node dissection, removal of lymph glands for cancer, and destruction of lymph glands by cancer. The clinical features. It presents as clear or hemorrhagic papules, often described as frog spawns. The small bumps tend to ooze a clear or milky fluid after some minor injuries. The most common sites of these lesions are the armpits after a radical mastectomy, the thighs after lymph nodes clearance for cancer, the vulva after surgery or radiotherapy to cervical cancer, the penis and scrotum after removal of a tumor at the base of the spine. Diagnosis of congenital lymphangiectasia. A thorough physical exam with evaluation of complete family medical history. Blood tests including lipid profile, cholesterol levels, serum protein, etc. Radiological imaging studies of the affected region to study the dilated lymphatic vessels. Genetic tests and analysis to confirm certain congenital forms of lymphangiectasia. Angiographic studies such as lymphangiograms to the affected regions. Upper GI endoscopy for individuals with gastrointestinal symptoms. Tissue biopsy is also used for the affected region. But the diagnosis of acquired lymphangiectasia, in most cases, the history and examination findings will be enough to explain the lesions. Skin biopsy may be necessary to confirm the presence of thin-walled lymphatic vessels. Imaging and other tests may be necessary to establish whether there is a leak or blockage in the lymphatics. About the treatments, acquired lymphangiomas can be difficult to treat. The affected area must be kept clean to reduce the risk of infection. Compression may be useful to reduce swelling caused by lymphoedema. Sometimes electrosurgery, laser therapy, sclerotherapy, cryotherapy, or surgical excision may be attempted. Thank you.